STPs, ACOs, CEPs, nailer reviews. It all gets rather complicated after a while, doesn't it? As a frontline healthcare professional, let me cut through the bullshit and simplify things. Put the patient at the heart of everything you do. I wish I'd compared notes with Jackie first, because I am actually going to talk a little bit about patients, but primarily so we can put them at the heart of what we do and try to put ourselves in their position. Ken earlier on talked about the patients who are waiting in an ambulance over 1 hour to get into the emergency department. Now think about it. You have a pneumonia. You're breathing at 40 breaths per minute. Your heart is pounding at 120 beats per minute in your chest. You have a fever, you are shivering, and the ambulance is hurtling towards the A&E department. You get there, you have a sense of relief. You think you're there, you think you've crossed the line. And then that hour begins, that 2 hours begin, those several hours begin. Each breath, worried and frightened it would be your last, remembering the headlines from last winter. Who can forget the image of the mother who took her child and placed it across 2 chairs just to find a horizontal space for her child to lay on? All of us, in one form or another, can imagine the immensity of a mother's love for her child. How is that hour, that 4 hours, that 8 hours spent when you're worried about that child? I heard from a campaigner earlier on that a man thought it was perfectly okay for a woman to spend 4 hours in labour in the back of an ambulance waiting to get to a maternity unit. Last winter I looked after a homeless migrant. We had the Docs Not Cops session earlier on. A migrant who had substance abuse issues, a migrant who was on the streets, who was marginalised, who was not really part of society, someone we walked past. He came in with a diabetic emergency. He came in repeatedly with diabetic emergencies. We couldn't send him to the streets. There was nowhere to keep his insulin. We fought, we kept him in hospital, we tried to get him housing. It wasn't easy, it took up the bed, people weren't happy, but we did it. These cold mornings have started again. It's foggy. We're struggling to get out of bed. Inevitably, there are households where elderly people have fallen over and spent 1 night, 2 nights, maybe 3 nights on the floor with their muscles breaking down in that cold. We've had spouses who've gone up to their husband, offered them food and water, hoping they'd get the strength to stand up again because they've heard that the ambulance service is in crisis and they don't want to call the ambulance out. By definition, there is no care in the community when elderly people present to me in that state. Five years ago, in 2012, when the world was celebrating the Olympic Games with Danny Boyle's extravaganza celebrating the NHS, a consultation started in northwest London called Shaping a Healthier Future. Boo, exactly. I remember going to a church hall in Hamwell and meeting like-minded people who put the patient at the heart of everything they were doing. That group grew slowly over the years into Ealing Save Our NHS. As a consultant, I could work in the hospital knowing there were dedicated members of the community who were sitting through every boring CCG meeting, every boring scrutiny meeting, going through every pound sign in documents and campaigning and looking after the community so that I could do my job. 5 years later, last week, NHS Improvement put a halt to Shaping a Healthier Future. It is a temporary halt. We know it's a temporary halt, but we must still celebrate that, because those people who put patients at the heart of everything they did, dedicated their time, put in all that effort, deserve to know that they weren't just screaming and shouting about something that everyone else disagreed with. They were saying this emperor is stark bollock naked, and people are starting to recognize this emperor is stark bollock naked. There is a blueprint somewhere that McKinsey's has produced. It talks about how we will move services into the community and we won't need an acute sector. All of us are in different stages of that blueprint. All of us are at different points in a timeline. I do think it is now very important that we collect data, that we identify where we are on that timeline, that we look at the successes, we look at what they're trying to achieve in other areas, and we try to collaborate with an infrastructure, almost a research infrastructure, that combats this McKinsey's blueprint. There is no evidence basis to what they are trying to do. There is a huge evidence basis against what they are trying to do. We have a mountain to climb, but I do believe that if we continue to put the patient at the heart of everything we do, and not the pound sign at the heart of everything we do, then we will find the inspiration to climb that mountain and help our patients. Thank you.
Thank you, Gurjinder.